A feeding tube is a medical device used to provide nutrition to people who cannot obtain nutrition by mouth, are unable to swallow safely, or need nutritional supplementation. The state of being fed by a feeding tube is called gavage, enteral feeding, or tube feeding. There are dozens of conditions that may require tube feeding. The more common conditions that would necessitate feeding tubes include prematurity, failure to thrive, or malnutrition, neurologic and neuromuscular disorders, inability to swallow, anatomical and post-surgical malformations of the mouth and esophagus, cancer, and other digestive disorders. Medical nutrition companies make flavored products for drinking and unflavored products for tube feeding. These are regulated as medical foods, which are defined as a food which is formulated to be consumed or administered enterally under the supervision of a physician and is intended for a specific dietary management. There are many different types of feeding tubes, and the type of feeding tube that a patient receives is based on their immediate needs. A nasogastric feeding tube, also called an NG tube, is passed through the nostrils, down the esophagus, and into the stomach. This type of feeding tube is generally used for short-term feeding, usually less than a month, though some infants and children may use an NG tube long-term. Individuals who need tube feeding for a long period of time are typically transitioned to a more permanent gastric feeding tube. The primary advantage of the NG tube is that it's temporary and relatively non-invasive to place, meaning that it can be removed or replaced at any time without surgery. A nasojejunal tube, or an NJ tube, is similar to an NG tube except that it's threaded through the stomach and into the jejunum, the middle section of the small intestine. A gastric feeding tube, called a G-tube, is a tube inserted through a small incision in the abdomen into the stomach and is used for long-term enteral nutrition. Gastric feeding tubes are suitable for long-term use, though they sometimes need to be replaced if used long-term. The G-tube is useful when there is difficulty with swallowing because of neurological or anatomic disorders, and to decrease the risk of aspiration pneumonia. However, in people with advanced dementia or adult failure to thrive, it does not decrease the risk of pneumonia. A gastrojejunal feeding tube, or a GJ tube, is a combination device that includes access to both the stomach and the jejunum, or the middle part of the small intestine. Typical tubes are placed in a J tube, or a G tube or stoma, with a narrower, longer tube continuing through the stomach and into the small intestine. The GJ tube is used widely in individuals with severely impaired gastric motility, high risk of aspiration, or an inability to feed into the stomach. It allows the stomach to be continually vented or drained while simultaneously feeding into the small intestine. GJ tubes are typically placed by an interventional radiologist in the hospital setting. In a person with a GJ tube, we need to be aware that this is a combination device, and there are two places that medications and feeding can go. The G tube ends directly into the stomach, and the J tube ends right into the middle section of the small intestine called the jejunum. So we need to be aware of what goes where. Depending on the type of GJ tube, some people have a direct tube that attaches to the skin disc and is not removable. Other people have a button directly outside of their abdomen that you can attach and disconnect tubing to. No matter the type, there are clear markings saying jejunal or gastric, either on the tubing or on the button itself. We need to be aware of these markings because this dictates what materials to put in where and where those materials are going to end up. People can receive tube feedings via bolus, using gravity bags, and utilizing a pump. A feeding pump delivers tube feeding at a specific prescribed rate. The settings should never be tampered with unless instructed to do so by a physician. Whenever a new feeding bag is used, we must thread it through the pump and make sure that the tubing is fully primed with feeding before attaching to our clients. There is a button for priming tubing located on the front of the pump, and never prime a pump while still attached to a client. Make sure that the pump is on hold whenever you're disconnecting from the feeding tube. And always flush the feeding tube with water after disconnecting from the feeding pump. Never leave tube feeding sitting in the G-tube, as it can form a plug very easily. Monitor battery life of the pump. Always plug it in at night. You don't want the pump to die if you're going on an outing or an appointment. Complications associated with gastrostomy tubes include leakage of gastric contents, which contains hydrochloric acid, around the tube into the abdominal cavity, resulting in peritonitis, which is a serious complication that can cause death if it is not properly treated. Septic shock is another possible complication. Minor leakage may cause irritation of the skin around the gastrostomy site or the stoma. Barrier creams and other prescription ointments protect the skin from the corrosive agents and are used to manage this symptom. It's important that we are continuously monitoring the stoma and button site for any increasing redness, warmth, or colored discharge from around the button. Prevention is key. Preventing mechanical complications of feeding tubes helps ensure that our clients receive proper nutrition and hydration intake. Important interventions include monitoring tube location frequently and securing the tube. The button outside of the stomach is not designed to move around in a circle. It must stay put. If the button is twisted, in turn it will twist the two tubes inside the body and cause a blockage, causing that tube to need to be replaced. Also, flushing the tube regularly is the easiest and most efficient way to keep a tube patent. We also need to be using proper medication administration technique when giving meds through a GJ tube, making sure that meds are going through the right port. The jejunal tube is much narrower than a gastric tube and can become easily clogged. Medicines or liquids can plug a feeding tube if it is not flushed out correctly. It's important to flush with enough water before, after, and in between giving medications. It's also important to flush the tube at least every 4 to 6 hours if someone is on a continuous tube feeding. You should flush with enough water to clear the tube of any contents seen in the tubing. And you should also flush each time you disconnect or reconnect the tube from the button. If the tube does get plugged, you can try to flush it with 5 to 10 milliliters of warm water by allowing the water to flow down in a syringe attached to the feeding tube by gravity. If you hold the syringe above the stomach, liquid will flow into the tube by itself. If this method doesn't work, add 5 to 10 milliliters of warm water to a 60 milliliter syringe with the plunger in place. Attach the syringe to the tube and use a gentle push-pull motion. This might loosen the plug. Do not pull too hard on the plunger of the syringe. Pulling hard could damage the tube or the stomach lining. If you've exhausted all options for removing a plug in the G-tube, contact the DRCC nurse as soon as possible via the phone number and email address listed. If the DRCC nurse is not available, the client may need to be taken to the emergency room for tube replacement.